Hi friends, good morning and welcome to my channel Mukambika Nursing. Here in this video we can see some questions for exam preparation, and today's questions we can see first question. Physician wants central venous catheterization. The nurse must know that all of the following vein can be used for insertion of central venous catheter except, and options are option A subclavian vein, option B jugular vein, option C portal vein, option D femoral vein. Here question is which vein is not used for central venous catheterization, and the correct answer is option C portal vein is the correct answer. Mainly for the central venous catheterization, the preferred vein is subclavian vein and jugular vein. Jugular vein and option A and B, jugular vein and subclavian vein is the most preferred vein for central venous catheterization. And femoral vein is there. That femoral vein, brachial vein, median and basilic vein can also used for this central venous catheterization, but this portal vein is not used for central venous catheterization. So our question answer is option C portal vein. Question number 2. Newborn receives which type of immunity from colostrum? And options are option A active immunity, option B passive immunity, option C active natural immunity, option D passive artificial immunity. And correct answer is option B passive immunity. The colostrum, which colostrum is the first breast milk which provide immunoglobulin A that gives passive immunity to newborn. Correct answer is option B passive immunity. Question number 3. Normal bowel emptying time of newborn is. Options are option A 1 to 2 hours, option B 1.5 to 2.5 hours, option C 2.5 to 3 hours, option D 3 to 4 hours. And the correct answer is option C 2.5, that is 2.5 to 3 hours is the normal bowel emptying time of newborn. That is every 2.5 to 3 hours once they can pass or they are passing motion or urine. That is normal bowel emptying time. Okay, here option C is the correct answer. And the next question. Question number 4. Which of the following IV solution have same osmolality of body fluid? And options are option A isotonic solution, option B hypotonic solution, option C hypertonic solution, and option D all of this. Here correct answer is option A isotonic solution. This isotonic solution have the same osmolality of body fluid. And for example, for this isotonic solutions is 0.9% NS, RL, 5% dextrose in water are some examples of isotonic solution. Question number 5. Which of the following are the neurotransmitters in the brain and spinal cord? Options are option A GABA, option B dopamine, option C adrenaline, option D all of this. And the correct answer is option D all of this. All of this, that is GABA, dopamine, adrenaline, all are the neurotransmitter in the brain and spinal cord. And GABA means gamma aminobutyric acid. Question number 6. Example of sensory cranial nerve is. Options are option A olfactory, option B optic nerve, option C vestibulocochlear nerve, and option D all of this. Here question is which is the example of sensory cranial nerve, and the correct answer is option D all are the example of sensory cranial nerve. Option D is the correct answer. There are 12 pairs of cranial nerve. Among this purely sensory nerve is there or purely motor nerve is there. Both sensory and motor nerve is there. Here our question is sensory cranial nerve. Here olfactory nerve, optic nerve and vestibulocochlear nerve are the example of sensory cranial nerve. Question number 7. Dash is a protein produced by the liver in response to systemic inflammation. And options are option A Z-reactive protein, option B homocysteine, option C pepsinogen, and option D none of this. And here correct answer is Z reactive protein, which is produced by the liver in response to systemic inflammation. And the next question. Question number 8. Duration of QRS complex is. And options are option A less than 0.1 second, option B less than 0.5 second, option C less than 0.12 second, and option D less than 0.3 second. And correct answer is option C, less than 0.12 second is the duration of QRS complex. This QRX complex means it represents ventricular depolarization, that is QRS complex, and its duration less than 0.12 second. Question number 9. Chronic inflammatory disease of the aortic arch and its branches is called. Option A, Tachyarsis disease, option B, Raynaud's disease, option C, syphilitic aortitis, option D, all of this. Here the correct answer is option A, Tachyarsis disease. It's a chronic inflammatory disease of aortic arch and its branches. The other name of this Tachyarsis disease is pulseless disease. Question number 10. Virchow triad is one of the cause of which disease condition? And options are option A, aneurysm, option B, deep vein thrombosis, option C, Raynaud's disease, option D, aortitis. And the correct answer is option B, deep vein thrombosis. Virchow's triad is one of the cause of deep vein thrombosis. Option B is the correct answer.